Over the past few years, politicians and leading NHS figures have engaged in an ongoing battle against people who are obese. There's a tax on sugary drinks that is now official government policy, and further consumption taxes could well follow, possibly on other sugary products or salt or fat. Some branches of the NHS are seriously discussing denying certain treatments to obese patients, and every week we seem to hear of a new shocking statistic about the supposed cost of obesity to NHS resources. The head of the NHS, for example, claims that £16 billion a year is spent on obesity-related conditions. That's more than the police and the fire service put together. And one analysis even claims that obesity puts a bigger burden on the UK's economy than armed violence, war and terrorism combined, costing the country an astonishing £47 billion a year. So people who are struggling with their weight have become the go-to scapegoats for NHS inefficiency and any funding shortfall in the National Health Service. But the truth is that practically all of these estimates and recommendations are rooted in myths, bad economics and prejudice. When these studies attempt to calculate the cost of obesity, they often use gross figures rather than net figures and arrive at the most exaggerated, extreme estimates that anybody can find. For example, the £16 billion figure includes all NHS spending on diabetes, including all cases of type 2 diabetes, even though only a minority of type 2 diabetes cases are caused by obesity, and it includes all cases of type 1 diabetes, which isn't caused by obesity at all. That £10 billion is then added to a figure of £6 billion, which is an estimated cost of obesity that already includes all obesity-related diabetes. So this is worse than double counting. This is a totally made up number in effect. These tactics build resentment towards a vulnerable group, obese people. It promotes a popular myth that certain minorities are a drain on the taxpayer and allows policy to be dictated on these terms. But the reality is that we all have to die from something, and healthcare costs of someone who lives into their 80s and 90s are higher than somebody who doesn't. The annual healthcare costs of a person aged 85 or over are 5 times higher than those of somebody in their early 60s and 10 times higher than somebody in their 40s. People in the older demographic are also far more likely to receive the most expensive treatments for diseases like dementia and other conditions that require around-the-clock care. So while it's certainly true that reducing obesity might be desirable for the individuals concerned, who would enjoy longer and healthier lives by slimming down, it's time obesity was reinterpreted as a problem for the individual, not for government. The NHS crisis stems from years of putting off much needed reform. Even with our ever-growing waiting lists and comparatively poor patient outcomes, our government still refuses to seriously consider other healthcare systems, such as that of Switzerland and Germany, that are getting better results. The ageing population is a real time bomb ticking away under the NHS, not obesity. And unfairly blaming patients for the long-term structural problems of the NHS won't do anything to improve either situation.